On 3rd April, India registered 3,637 new cases of COVID-19. On 2nd April, about 3,800 cases were reported, which was the highest increase in a day in the past 6 months. The rising cases of COVID infection come after a long dry spell when daily cases of infection hovered at less than 500 since December last year. Let's find out how doctors and virologists read the increase in the number of cases.
The most important thing is that we have dropped our guard. We're not using a mask. And that is the cause of the surge that we are seeing. As of today, it is more in the north region when I'm talking about Delhi NCR and Punjab, because we have hospitals here. We keep getting our feedback on how it is. The positivity rates are in that 15-20%, which has gone up substantially.
Well, the rise in number of cases, if you look at the numbers, we have roughly 3,800 or so cases coming right now per day. Compare that to the population of India of 1.4 billion, it's minuscule. People are worried because we have gone from a low of about 60 odd cases to 3,800 cases. So yes, in terms of percentage, the number is high, but when you start from a very low baseline, it appears very big, but it's not. It's just a minor blip right now.
What may put anxieties around increasing cases of COVID-19 at bay is the recovery rate, which is robust at 98.77%. This is substantiated by the fact that India has vaccinated at least 95 crore citizens, including adults and children aged more than 12 years. The exponential spread of disease in the past 3 years had also led to some form of immunity among the masses as well. These factors, together, made COVID-19 non-threatening in the subcontinent. But what triggered the sudden spike in cases now?
Well, I think one reason is that a new variant has developed, which is better, let's say more infectious than previous variants. And you may be hearing about something called XBB1.1.16. To just break it down, this is a variant that has arisen because of combining of two earlier variants and a few mutations on top of that, which essentially means that it is very good at evading pre-existing immunity that we have built because of vaccination or prior infection. So the number of cases are going up.
India had witnessed devastating COVID-19 waves. While the active case load today is not as high, it has still crossed the 20,000 mark. At least 7 deaths were reported. So, are there any chances that this increase in cases might turn out to be another COVID-19 wave?
It's unlikely, and there are various reasons to it. I think so. The good part is that India has had a very good penetration of being vaccinated. At least the 2 doses, they have, a majority of the population has got it. Many of us have had COVID earlier, so that also gives us some inherent immunity. Those who have not even suffered from COVID, they have been exposed to the virus, so the body also again has developed some immunity. Based on all this, I think so India is in a much more sweet spot than many other countries.
With increasing cases, many state governments have released guidelines for protection. The Delhi government recently issued an advisory to wear masks, especially during hospital visits. The government of Haryana, too, released an advisory asking healthcare officials to record the travel history of infected people. Do these developments point towards another countrywide COVID protocols, such as social distancing, etc.?
Well, it's now pretty clear based on multiple studies that mask mandates don't work. It doesn't mean that masks don't work. Mask mandate means if the government says everyone, going out must wear a mask. Yes, people will wear a mask, but some will have it hanging by their neck. Others will have the face covered, but the nose open, all kinds. And therefore, mandates don't work. But on an individual basis, if I'm wearing a mask and wearing it properly, it does protect me. And more importantly, if I have a cough and cold and I wear a mask, then it definitely protects other people who are around me.
Although COVID-19 cases are increasing, healthcare experts see nothing to panic since the majority of Indians are vaccinated. However, COVID-appropriate behaviors such as wearing masks when sick and among large crowds are advised. A critical factor is taking the precautionary third dose of vaccine, the rollout of which has been slow for the past few months.
If you like this video, share it and subscribe to Business Standard. For more news, views and insights, log on to www.business-standard.com. Do also follow us on YouTube, Twitter, Facebook, Instagram, Telegram and LinkedIn.